Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about how to relieve carpal tunnel pain. So carpal tunnel is a compression of a nerve in the wrist. That compression can actually happen further up the nerve chain. The nerves that are in the hand, they start in the neck, they run down through the arm into the hand, and you can have multiple points of compression and entrapment for the nerve. So first of all, figure out where it's at and then start addressing the compressive issue with the nerve. Sometimes it happens at multiple points throughout the arm. But the therapies that are going to be most beneficial are, first of all, they're going to depend on where the compression is occurring. If it's not compression, if it's something metabolic like biochemistry, like let's say for example diabetes, then we have to address the metabolic component, and we help people do that in our office. I practice something called functional medicine, which looks at the drivers of disease processes. We work very extensively with diet and temporary nutritional changes, lifestyle changes to help people improve diabetes. We've taken A1C markers from over 11 down to normal. So we know it can work. We've done that in about 6 months, and in about 3 months made huge differences. So it can be done, but if you've got diabetes, for example, you have to address the metabolic component while doing some of the therapeutic approaches I'm going to talk about. So what we do in our office is we first of all figure out what's going on to the best of our ability, then we implement a plan. Most of the time, if we're talking about therapeutic approaches, we're going to be using things like non-surgical spinal decompression therapy, which helps to take pressure off the nerve at the wrist. If there's neck compression and also a neck problem, then we might use it on the head and neck to take pressure off the nerve at the neck and help the disc to improve its health. The next therapy, probably most common, is going to be laser therapy. Now, laser therapy is non-thermal. It will not burn you. It is not a surgical laser. We use something called a super pulsed laser that has very high power, but because it's pulsed very rapidly, it doesn't create a thermal effect. So we get a very high dose of laser energy, which helps to decrease pain, improve circulation, decrease inflammation, assist with tissue healing, does a lot of different things. I mean, there's a huge list of benefits of laser therapy that we can get the benefits without the risk. Okay, so it's really important to understand that. So we'll use laser therapy directly on the nerve because we know that the red light and laser therapy can help with something called nerve growth factor production. And as that may sound, that's really important when you've got a damaged nerve that's dying. Nerve growth factor can be very helpful for helping it to heal. So we want to work on taking pressure off the nerve. We want to work on improving the ability of the nerve to heal. Then we want to use something to stimulate the nerve. So we use something called peripheral nerve. Peripheral meaning outside the brain, spinal cord, which is what this is. It's called a peripheral nerve. Peripheral nerve rehabilitation therapy. So it's a type of electrical therapy that stimulates the nerve and helps it to have better metabolism. It's kind of like exercise for the nerve to try and get it healthier. So we approach it, with energy, with light. We approach it physically with decompressing it. We approach it also from, from this perspective of exercising it, stimulating it to try and improve its metabolism. And then if you have biochemical problems, I mean, if you have diabetes or an inflammatory process, you cannot ignore that and get better. I mean, you just cannot. They're not separate. If someone goes to their doctor and they have carpal tunnel, but they have rheumatoid arthritis, for example, or they have they're diabetic and their blood sugar's all over the place, that's going to kill the nerve. You've got to address that at the same time you're doing these therapies to heal the nerve, or you're going to fail. So that's just the way it is, and that's something we always want to look at. I want to know if that's going on because there's a good chance if you're willing to change your diet, if you're willing to make a few changes, then I can help you with the biochemical aspect of it. In most cases, we can really make a big difference, but you've got to be willing to change a few things. You got to be willing to change your diet and take some nutritional supplements temporarily, and maybe even change your lifestyle a little bit to improve your health. And if you're not willing to do that, then I probably can't help you. I'll be straight up with you. I just want you to get better. And it's not right or wrong. It's just what's best for you. If I can't help, then I'll help point you in the right direction. But I'll do my best. So I hope this helps you to better understand how to relieve carpal tunnel. It really comes down to what's the cause, and then the treatment is formulated based off of that. But there's we use a lot of advanced therapies that can be very, very helpful. And I'll be happy to give you my opinion on your case and let you know if I think I can help you. If I can't, I'll point you in the right direction to the right specialist. But if you're interested in an appointment, just give us a call. It's 828-324 You can also find out more about our practice at hickoryspine.com. But I hope this helps you out to understand carpal tunnel, how to relieve it a little bit better, and hope you have a great day. Thanks.